and welcome to the We Talk Health podcast, the official podcast of West Tennessee Healthcare. I'm your host, Kara Mobley, and on today's episode, I have with me Brandi Pruitt. She is a nursing director here at West Tennessee Healthcare, and our topic for today is going to be a little bit about the Donate Life Month, Donate Life ceremonies, the James Ross Angel of Hope Award. We're going to kind of go into all of that. So first, let me welcome you. Welcome to the show, Brandi.
Thank you.
Thank you so much for coming. And we've got Byron Elam in the studio as well. He is the External Affairs Coordinator with Tennessee Donor Services. And he is going to, kind of at the end of the podcast, since we've talked to you before, Byron, a little bit about what Tennessee Donor Services has done and what achievements and things have happened in 2024 from the password.
Yes.
So thanks for being back with us, Byron.
Thank you for having me.
Great. So Brandi, tell us a little bit about your journey into the nursing field.
Okay. Thank you for having me today as well. So about 10 years ago, I started my journey as a bedside nurse in the cardiac ICU at Jackson General, where I gained a lot of hands-on experience. I was able to participate and take care of a lot of the patients who were serving as donors through TDS as well. So then after some time at the bedside, I furthered my education and shifted my focus to nursing education. I was a clinical assistant professor at the University of Memphis at the Lambeth campus, where I taught in the BSN program there. And then back last year in January of 2024, kind of made full circle and came back, and now I'm the director of nursing in the cardiac ICU, medical ICU, and ICU transport team at Jackson Madison County General Hospital.
Great, yeah. And so I know a lot of people with this kind of background with nursing, and especially with your job as nursing director. What would you say inspired you to pursue a career in medicine?
So honestly, I can't really pinpoint a specific moment or reason. It was just more of a feeling that grew over time. I've always been drawn to helping people, and I wanted to do a career that I could make a difference in. So nursing felt like the right fit eventually before I really fully understood why. So over the years, I have been validated by that choice through the people I've cared for, the families that I've supported, and the moments that I've witnessed throughout my experience as an ICU nurse. So sometimes I feel like you don't always have all of those answers at the start, but you definitely find them along the way.
Right. Especially, with nursing, it isn't just, it's not for everyone. And so it is something there does need to be a passion there for people who are in that field.
Absolutely.
And especially, you said you were in the cardiac ICU. So I know you mentioned up top, TDS, Tennessee Donor Services. How do you and your department support the work of organ donation?
Good question. Our departments are deeply committed to supporting organ donation, and we work closely with our clinical teams to ensure that every potential donor is identified and cared for with compassion and respect. As part of this effort, I serve as one of our liaisons with Tennessee Donor Services to help support and coordinate communication between our hospital staff and the donation team. I work closely every day with our awesome in-house coordinator, Laura Bryan.
Yeah, shout out, Laura.
That's right. We team up on everything from talking through open referrals to planning T-shirt sales for Donate Life Month to updating policies and procedures, organizing honor walks, and anything else that comes up along the way. There's not many days that goes by that Laura and I don't have some kind of conversation about something. So together we work to honor the wishes of the donors and their families, and to streamline that donation process and ensure that every opportunity to save or improve lives is recognized and supported.
Yeah, and as someone who's in a communication field, communication and having a liaison between, what you do and what Tennessee Donor Services does, that having that relationship and having a good relationship, it really goes a long way to help, especially, with the people it impacts.
It does.
So how has your experience with organ donation impacted you?
So working in a hospital that's not necessarily a transplant center, we most focus on the donation side and on the donor side of the process. So we don't always get to see the outcome of the life saved or transformed on the other end. So our staff always looks forward to reading the letters from Tennessee Donor Services that tells us where our patients that we cared for, where their donated organs went, and the lives that they touched. So after every recovery, Laura sends us out letters that Of course, it identifies the patient based on their age and their race, just to kind of give us a roundabout idea of which patient it was, and which organs they were able to donate and what lives those went on to save. So our staff really like to see those letters because that kind of, since we don't get to see it firsthand, those stories help connect us to the bigger picture.
Exactly, yeah. Especially with bigger picture, the side that you're on. And I mean, it's very bittersweet, I have to imagine.
It is.
Dealing with the organ donation process.
And also, so like I said, most of our work here focuses on supporting families during those challenging times and honoring that gift of donation. But it's easy for us to forget that life-changing impact that organ donation has on the recipients. So recently, I have a 37-year-old cousin who received a kidney transplant. She suffered some kidney failure due to some postpartum complications. So watching her journey from dialysis to recovery has deeply connected me to the power of donation. It reminded me that behind every donor, there is someone like my cousin who's a person's life that's forever changed because a family chose to say yes in that moment of grief.
Right, exactly. And I know so many people are impacted by it in some way or another. Like my grandfather, when he passed away, they called, and it's such the job of calling the family and saying, hey, could this person donate anything? That's such an important conversation to have, and just having people doing those jobs is great. So now I know this year this is going to be the first year we're going to be having the James Ross Angel of Hope Award. Tell us a little bit about that.
So as most of us know, our organization suffered a huge loss back in September when our CEO, James Ross, passed away. I don't think it was any secret at all that JR was devoted to helping others. Yes. Part of that devotion was saving and healing lives through organ and tissue donation. He wanted to be a part of decreasing the waiting list that has over 100,000 people on it. So in response to that, an award has been created through TDS called the James Ross Angels of Hope Award. One of JR's famous mottos was meeting the need and making the difference. And I feel like organ and tissue donation does just this.
Exactly. Yes.
So I think it's a wonderful opportunity to meet the need and make a difference in the lives around you. So this award's going to be awarded every April to a hospital department who in the previous year has demonstrated an unwavering commitment to saving lives and helping families find healing through donation. So that's just a way for their efforts to be recognized and hopefully inspire others within the hospital to do that same type of work.
Great, yes. And this is going to be presented at the Donate Life ceremony at Jackson-Madison County General Hospital, correct?
Correct.
Okay, great. Mm-hmm. So we'll talk about that a little bit more at the end. But so I want to talk about 2024. It was a record-breaking year for the number of donors served at the hospital and ultimately lives. Any ideas on why we've seen this growth?
Yeah. So in 2024, we had a total of 34 organ donors from Jackson-Madison County General Hospital whose generous gifts resulted in 79 lives saved. So I believe the growth is a result of a combination of increased awareness, stronger partnerships with our organ procurement organization, which is Tennessee Donor Services here at Jackson, and just that hospital-wide commitment to recognizing the donation opportunities early on. We've also put a lot of effort into education and process improvement, which has really helped streamline that pathway to donation as well.
Yeah, exactly. And I know, even with this podcast and with National Donate Life Month, just getting that awareness out there is so important. And obviously we can see those results, which is great. So some of it is, that there are a lot of myths surrounding organ donation. One of the most common is that if you're a registered donor, medical professionals won't work as hard to save your life if you experience a medical emergency. Now, that's a myth that's been going around a lot. Can you address this myth?
Right. Yeah. So
that's probably the one that people talk about the most.
Right. So that's absolutely not true. Our priority, especially in the ICU, is to always save lives. The medical team treating you is entirely separate from the organ donation team. Donation is only considered after every effort has been made to save a person's life and death has been declared. So care is never compromised based off of your donor status.
Right. And I would assume that would not even come up. Like, you're not asking those questions up top. You're saving their life, and then
correct.
Ultimately, that's when the conversation goes to.
Yes, once we reach that point, and we've collaborated with our partners at Tennessee Donor Services to make that referral at that time is when those discussions happen.
Right. And so what would you say to those that may be hesitant to register as an organ donor? Because I know there's, a lot of hesitation for a lot of people when you ask them to register.
Right. I would say leave a legacy. I don't believe anyone will ever regret giving life to someone else. I've truly seen the healing that it can bring to a donor family to know that every day someone else is living to honor their loved one. Right. So just take the time to learn more and have conversations with your loved ones. Registering as an organ donor is the most selfless decision that you can make. It's an opportunity to save and improve lives, even up to 8 through organ donation and many more through tissue. So your legacy could be one of hope.
Yeah, and I know last year I had interviewed a few funeral directors, and it's, a lot of people are like, well, what are they going to look like, at the funeral? So there's all kind of measures that they take, to take great care and show respect as well.
Absolutely.
So we've got the Donate Life ceremony coming up. Tell us a little bit about that.
So our Donate Life ceremony at Jackson Madison County General Hospital is going to take place on April the 23rd at 1:30 p.m. Anyone and everyone is invited to attend. The ceremony is going to take place inside our main entrance there inside of the revolving doors. We encourage attendees to arrive early to write a message of hope to be displayed in honor of our donors and our recipients.
Right. Yeah, so it's for donors and recipients.
Correct.
And then also I've seen videos of honor walks on social media. Is that something that Jackson Madison County General Hospital does?
Yes, that's something that we do and have recently implemented, probably within the last year. So an honor walk is actually a hospital ceremony that honors organ, eye, and tissue donors. The hospital staff, along with family and friends of the donor, line the hallway as the donor's bed and body is transported from the ICU to the operating room. This signifies appreciation and the support for the donor and their family. Right. So it's a way for the family and friends to say goodbye, but also acknowledge that selfless gift of life. So we actually drape a flag over their bed, a Donate Life flag, and then at the end, that flag is folded and presented to the family as they're going into the OR.
Yes. So that's going to be, you said April 23rd is the Donate Life ceremony. And I don't know if, Byron, you want to give us any kind of information from Tennessee Donor Services about some of the impacts that have happened or anything going on with you guys?
Well, we're just happy to celebrate yet another Donate Life month to celebrate those that have given this the selfless gift of life, and also to encourage those to consider donation. As we know, we have on any given day in this country, about 100,000 Americans that are waiting for the life-saving gift of an organ. About 3,000 Tennesseans, about 5,600 folks will die every year waiting for organ transplant. Unfortunately, they will not receive it in time. So it's an opportunity for us to celebrate life and hopefully to encourage folks to consider giving the gift of life so that we can save more lives.
Right, exactly. And so, yes, all of us have the opportunity to potentially save and improve lives. And if you would like to register to be a donor, you can go to the website bethegifttoday.com. And I will also be sharing this information on the show notes. And yes, Byron, so my first podcast I ever did on the show was our Donate Life podcast in 2023. So it's good to have you back on the show and good to have another conversation about Donate Life Month and bringing awareness to this great cause and trying to get more people registered to save more lives. All right, guys. Well, thank you both so much for being here today.
Thanks so much.
Thank you, guys. Thank you for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.